All right, which of the following is most appropriate treatment for this patient? A 4-year-old girl is diagnosed with Kawasaki disease after presenting with fever, rash, conjunctivitis, and cervical lymphadenopathy. She also has a red, cracked lips, swelling of hands and feet. Physician decides to initiate appropriate treatment. Which of the following is the most appropriate treatment? Kawasaki disease. I know it's children. I know it's this. Is this the one time that you're allowed to give aspirin to them, or is it caused by aspirin? Um, hmm.
What's your gut say?
I can't remember if Kawasaki is one of those is the vasculitis that's like caused by aspirin or you give aspirin. I don't know why you'd give IVIG and aspirin. Um, Corticosteroids is always a good choice for something like this, for swelling and inflammation. Antibiotics, I don't think it's I don't think it's bacteria related. I don't, same with viral. Um, or is this one that's caused by, hmm, I'm in between. I can't remember if it's caused by aspirin or you give aspirin. Hmm. I know that there's also a heart association with Kawasaki disease, which would make sense of why you would give aspirin, but I'm not sure if it's like a something in that realm. It might just be like a prolapse or something like that. I was
What's
just
your
looking
gut say?
to this.
Listen to your gut.
This was just in Bethlehem last night. He mentioned Kawasaki in the cardio chapter. That's why I'm saying that too. Um, I like the aspirin one for some reason that just makes the most sense, but I'm not sure.
It is the aspirin run. Okay,
Okay.
Kawasaki is treated
I
with
couldn't
aspirin
remember
and
if I was doing that.
IVIG. Okay, the disease
Okay.
that you're thinking about that causes issues is Ray's syndrome. Okay,
Okay, that's right. Okay.
yeah, Ray's gives you like encephalopathy and things like that, right? Hepatic issues and
That's why you
whatnot.
can't give, was it children like under 5 or something you can't give aspirin to?
Yeah, to aspirin with viral infections. That's the key.
Oh,
You
with
can't
viral
yeah,
infections.
if you have some kind of virus, right? Back in the day, we'd give aspirin to practically everyone and anyone, right? And
Right.
then they started noticing like, oh, when a kid has a viral infection, we give them aspirin, they start getting real sick, right? And so then
Hmm.
we started to realize, oh wait, we're gonna call that Ray syndrome. That's not good. We shouldn't do that, right? And
Okay.
so and that's aspirin in particular, right? But you can definitely give, Aleve and things like that, right? Tylenol, Aleve, those are okay for viral infections, right? But just not
Okay.
aspirin. But this is they love testing Kawasaki's because it looks like a virus, right? It has a
Yes.
rash, it has lymphadenopathy, you get fever, right? It looks like a virus, and
Yeah,
so
if this question didn't say Kawasaki, I don't know if I would have picked up that was Kawasaki.
yeah, so this is the key thing I'm trying to say here. Okay, we have to kind of put it all together: the cracked lips, the tongue, the hands, the feet, the cervical lymphadenopathy, because they will like testing this without saying Kawasaki's, and they'll say, "How do you want to treat this?" And then there's going to be things like, "Oh, conservative management," which is viral,
Right.
NSAIDs, right? And then there's going to be an answer that says aspirin, and you're going to be like, "Oh, I'll never give aspirin to a kid with a viral infection." No, 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 this is the exception. You want to give aspirin with IVIG.
Okay.
Okay, so they love testing Kawasaki's just because it looks like a virus and it's like quote unquote viral symptoms that you actually treat with aspirin because normal pediatric viral infections you don't give aspirin.
Okay.
Okay, good.